My husband hates cooking for me because every time he cooks, he goes, have you read anything recently? Because it all depends on how well done my meat should be, what vegetables I'm eating, how much I want him to wash those vegetables, and all those things that I need to do. And that all has to do with bacteria. Because when you look at the overview of microbiology, it's the study of one-celled microorganisms. And bacteria is the largest family. And some people call them bugs, microorganisms. And the outnumber is 20 to 1. So they are everywhere. They are in the food we eat, the water we drink, even your bottled water. If some of you buy that thinking that it's a little bit more pure, au contraire, it is not. It grows bacteria. And that's fine because we all live in a world of bacteria and we are designed to survive that, so it's not an issue. But they are there. The air we breathe, in and on our bodies, in the soil. They're plentiful in the soil. The only place in the world are the peaks of snow-capped mountains that don't have bacteria. So if you're trying to get into a sterile environment, that's where you're going to have to go because that's going to be the only place that you can do it. And when you talk about just the sheer numbers of how they outnumber us, 5 trillion average-sized bacteria fit in a teaspoon. Colonized body sites are your wounds, your upper respiratory tract, your nose, sinuses, throat, pharynx, and your stool cultures. As you all know, the public health rule number 1 is don't eat feces. And everybody's always taught that. Okay, infected and colonized. I know some places have practices where I won't take somebody who has this organism, or I won't take people who have that. You can make whatever practice you want, but you have to understand that those are only the people that you know about. You can have people that are colonized with an organism. They don't even know that they have it. They have it. So whatever practices you put in place, make sure that they protect you all the time, even if you do have someone that's infected, and even if it is your policy not to take that person who has that particular organism. And also remember that if I happen to have MRSA, I might not have it the rest of my life. I might have it, be colonized, it goes away, and then I'm fine. And you might then be dealing with someone that does have MRSA. They don't know that they have it, and they are there ready to transmit. So what you want to do is make sure that your practices reflect both infected patients and colonized. That whatever you do gets you coverage for your staff and your patients across the board. And you've already seen the epidemiological triangle. Is the methacillin-resistant Staph aureus, and it's just resistant to antibiotics, the beta-lactams, such as oxacillin, penicillin, or amoxicillin. And again, just a statistic, 1% of the population is colonized with MRSA. And that's probably a very conservative number. MRSA used to be associated with hospitals. Well, what they found is that it's going out into the community. There's now 14%, and that's, again, a statistic that probably hasn't been updated, but of all the infections occurred in patients or persons without obvious exposures to health care. So these are just some facts and figures. Bacteria-free ride. What contributes? They can do very well by themselves. They outnumber us. Remember, 20 to 1. So, any questions?
The question is on MRSA, what should we do about surveillance? I mean, we're getting some missed signals here.
You're going to hear a difference of opinion. Okay, so I'm going to give you the literature, as I just showed you, those numbers hold up. So if you do surveillance, you're not going to be 100% in picking up everybody who has it. So our philosophy has, in our university, and I think it's a solid scientific philosophy, is that protect as if everyone had it, do the procedures and protocols that would protect across the board, and then you could have missed it on the day that, because they don't carry it. You could have 2 negative cultures and then you have a positive. And if you then slack off and change your processes, then that's where you get in trouble. So your processes, and I know a lot of people have had success with culturing, and that's their choice if they want to go down that road. They need to do what works for them, but you have to realize that it's not 100%. Bacteria aren't 100%. It'd be nice if they were.